My name's Steve, and I manage the websites medicalcannabis.com.au and medicalmarijuana.com.au. And your names are?
Yeah, good morning, Steve. My name is Sharon. This is Neville Kelly, my husband, and our little Precious.
Okay, and you have a fantastic testimonial story to tell me, Sharon. You had stage 4 lung cancer, and you've battled it with cannabis oil, correct?
That's right, yes. Back on the 19th of December 2013, after an X-ray, the doctors found a mass in my lung, a 5 centimetre mass, and after that they did a CT-guided biopsy and identified it as non-small cell lung cancer. They did a PET scan on the 17th of January 2013. Because I had never smoked a day in my life, they thought that the cancer may be somewhere else in my body, so they did a PET scan, but the primary was my lung. But unfortunately, they discovered that it had gone into my lymph nodes, at least 3 or 4 in my chest, and a small lymph node above my collarbone there. And also they discovered I had fluid around my heart, and also in the pleura of my lung they thought there was cancerous nodules there as well, which made me stage 4. And they told me I had 6 to 9 months to live.
And you
pretty shattered.
You actually have images of the PET scans, don't you, that you've showed in other YouTube testimonials of the before and after. Is that a calendar that you had, Sharon? Did you have a calendar made up, or looks like a calendar?
No, well, I left it in the book. That's the book that the Queensland X-ray gave me with the pictures in, so I left them in the original folder when I put them on YouTube so people can see that I didn't Photoshop them at all. So I wanted to be really real and true and tell my story exactly the way it happened.
When they do PET scans, they take so many images, they actually put it in a binder, in a book for the, I don't know, to keep the doctors only ever looked at the disc, the images on the computer, but the book was for us, I guess.
Right, okay. And so where did that lead to? You had the PET scans, you were diagnosed with stage 4 lung cancer, and what happened then?
Well, we were horrified to find out that stage 4, they don't give any treatment. We both work at a hospital and you see cancer patients all the time, and they give them radiation and chemo and I said to the doctors, well, can't you take my lung out because my right lung is perfectly healthy? Mm-hmm. And he said no, because it was in my lymph nodes, it wasn't an option. And they said they could give me chemo, but it would only, give me a few more months, and those few months I might be sick with the chemo treatment. So that wasn't really recommended, and I certainly wasn't eligible for radiation. So at that stage I was really upset and angry that they wouldn't treat me. So I felt that I was healthy and young, and my daughter was getting married that August, and that's all I could think about. I wanted to be around for that. Sure. And to see her children,
Sure.
Yeah, and so with that we went home and we all just started looking on the internet. My daughter phoned me, the one that was getting married in August, and said, Mum, you've got to look at this, that there's a lot of testimonies on there, people curing cancer with cannabis oil. And so that started our big investigation.
Big search.
Yep. Neville did most of the work all night, searching on the internet for options and a way to get this oil in a state, in a country where it was illegal. Sure. Very, very challenging.
And what did you find, Neville, when you started doing your investigations on the internet? How did it all start? You found someone on the internet. You mentioned Stan Rutner before, Sharon. Was that the first?
Stan Rutner.
Was that? Sorry,
yeah, Stan Rutner's the person that lit our fire, if I could say, because we were reading more and more about the THC, the high THC levels in the cannabis oil that kills the cancer cells. And as we read, I came across early hours of the morning, it was a magazine, online magazine, Culture, I think it was, and they did a story on Stan Rutner. And well, the first article, because different articles are copied from different websites, and I read an article. It was very interesting. Then I just started Googling this Stan Rutner and come across more and more, and the most in-depth article that I found was on the Culture magazine online, and they had a lot of information, 2 videos of Barbara, Stan's wife, and it was just amazing that he had the lung cancer that had spread to his brain, and he was actually pretty well in hospice at the time they started the oil. So I contacted the editor and quoted the story and the journalist that did it, and within a day he got back to me with some contacts, and we're actually able to contact and speak to via Skype John and Corinne, which is Stan's daughter and son-in-law. So it was all very exciting, very exciting. Yeah. It's like a whole world opened up for us.
Mm-hmm. They were very instrumental in my recovery and me getting my treatment. We're forever grateful for
Stan and Barbara's kids. Are we talking about?
John, yes, Corinne. John and Corinne.
Yeah, Corinne is Stan, Barbara's daughter, and John is her husband. Right. And from what happened with Stan and them, they're treating Stan with cannabis and that, they started United Patients Group, which is an online website to help people. Consultancy, yeah.
Mm. So, sorry, just to stop you there, United, what was it called?
UnitedPatientsGroup.com.
And that's the web domain, UnitedPatientsGroup.com.
Yeah.
Okay, well,
they live in California, so it's legal there.
I'll actually stick a little link up on that on the website so other people can visit that group, and that might be a help. So you contacted Stan Rutner's relatives, and what happened?
I think all this was just building up our confidence in it. Yep. The more YouTubes we saw of young women with brain tumours not having chemo or radiation, just cannabis, and the tumours shrinking. And so that really built up our confidence, and we knew that was the only way for us. And we had actually decided to go over to the States for this treatment. Managed to get some of my superannuation money from work, and we were going to go over there. But unfortunately, I took sick. I'm on Tarceva drug as well that they're giving me, and I became unwell on that drug and couldn't fly. And so with that, after speaking to John and Corinne, they were able to connect us and help us.
Lots of information
to help us.
Well, you look pretty good now, Sharon.
I'm feeling wonderful. And I'm really looking forward to my next PET scan. I've got the PET scans from January, then the 3rd of September was my all clear, and then my next one's booked in a couple of weeks, on the 20th of January this year for my next PET scan. I'll be making another YouTube and presenting that and showing people my progress as well, because I think that's what's going to do it, just for me being here year after year and showing them that it does work, because a lot of people out there aren't believing. And I had trouble believing it, really. I didn't even know what cannabis looked like before I got this diagnosis. I had no idea.
It is.
And there's a lot of people working behind the scenes. There's a lot of groups in every state in Australia, a lot of people working hard to get this legalised in our country, and so hopefully one day, and this is our little part of making YouTubes to spread the word, for people that are giving a terminal diagnosis like me with no hope, and to tell them, keep looking and keep searching, because there is help out there.
It is hard to believe that it's not available now, because there's so many testimonials from people in the States that were given no hope. The doctors said, your life is over, or it will be over in a certain amount of a small period of time. But these people have beat it, and it's surprising that we can't have clinical trials happening right now for people like you, and so that you can source the cannabis oil legally and in a regulated way, so you know exactly the right dosage, the exact level of THC, CBD, and everything. So it's amazing that. We're supposed to be searching for a cure for cancer, and it seems to be in our laps. waiting for us to pick up. But the government are just taking too long to actually do it.
Even
so frustrating.
Even cancer companies here in Australia, where they're donated probably hundreds of millions of dollars a year, like searching for a cure for cancer, they just keep pouring the same money or new money into the same research, hoping for a different result. Where, like you said before about it'd be good if we could get the clinical trials here in Australia, like one of the good things Tony Abbott said, he doesn't understand why we need to reinvent the wheel. There's been so much research done overseas, in the United States, in Israel. There are so many countries where it's legal and it's been investigated and it's now being used as a medical first-line treatment in some countries, not even in America though. But the thing is, why do it again in Australia where these 4 years or whatever it's going to take and all the money and time to investigate all this, people are still going to have to do it legally or die while they're waiting.
We need the medicine now. People need it now. I would have been dead and gone without this, without the cannabis oil. I wouldn't be here.
You referred to Sharon before. We've spoken to people, medical people, about Sharon's results shown in the PET scans, and they basically said, as amazing that is, it's useless because it's only anecdotal. We needed to study you from the very start, blah, 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 the same old rhetoric.
Yeah.
And all this anecdotal evidence that you've just mentioned, which is so true, which is undeniable, they still don't recognise because it's not double-blind and all that, which I don't even understand why someone would volunteer to take a sugar pill, which is possibly going to kill them.
Well,
it's just like Russian roulette.
I mentioned that to Sharon in our phone conversation prior to this video Skype recording. I've applied to do clinical trials through Mike Baird, the Premier of New South Wales. But I would feel funny about giving someone a placebo when they've been diagnosed with terminal cancer. It's just, I wouldn't do it. I wouldn't want to be involved in the clinical trial. I want to be healed. I want to stay alive. I don't want to have the possibility of taking a placebo and seeing the people that were in the clinical trial with me survive, and I was the sucker that took the sugar pill. I just don't understand that.
If it was your wife or your mother, you wouldn't want that.
I realise there needs to be scientific research, there needs to be education on it, but people are surviving at the moment. And the longer you can survive, the better off you are. Obviously, and if you survive another 2 years, maybe within that 2 years there will be an absolute cure for cancer. They'll come out with a pill that you can just go bang and the cancer's dead. Who knows? But if we can just keep you alive for 5, 10, it's like HIV. That when they started controlling that and they came across something that, you don't actually get rid of the HIV, but you don't die of AIDS. People are still living 30, 40 years on from, being diagnosed with HIV. So,
they're dying from it.
Yes. I was a bit muddled in that conversation, but you know what I mean, don't you?
Yes, we know what you mean.
Yeah. Mm-hmm.
And it's, we can wait for the pharmaceuticals to synthesize it and make a pill and all that kind of stuff, but they just need to take the chains off the plant as it is now and where it's legal, and the people, the carers that are out there helping people with medical cannabis or treating people with cannabis all through the United States or even Israel, and then start using their documented procedures and how they do it so we can then get the right dosages, the right strains. No one's going to die of it, for goodness sake. There's been no overdoses. We watch the shows on TV where you got King's Cross ER, and the whole show is nothing about people that are there with heroin, methamphetamine overdoses, or they made absolute fools of themselves and almost got killed getting paralytically drunk. I've never seen anyone ever taken to ER from smoking or not, I don't even like smoking, but taking cannabis. You know what I'm trying to say?
Yeah.
So,
and that's the thing, and like I've mentioned that I didn't, I used the back door because I didn't like the high, but we had learned and researched enough to know that I was really safe, even though I had 2 episodes where I would say that I was close to stoned by accident, just juicing green leaves, and there was some brown ones in with it. And so in the afternoon, I got really stoned. I went and lied down, and I knew I was going to be okay. I just went off to sleep, and I was not scared that I would overdose and die or anything like that, because we had researched and known, and I was very, very confident using this as a medicine, very confident that it was safe. Yeah. Yeah,
no. I don't know if the brown leaves are more potent than the green leaves, Sharon. I think they're just a bit more withered.
Well, once the leaves dry out, I believe the THCA in the green, as they dry out, that's when they convert to THC. I'm not an expert by any means, but that's, I believe, when they pick the green plants, they hang them up to dry, and as they dry out, the THCA converts to THC.
So just about every day I juice green leaves, and there's no psychoactive high with that at all. But just this one time, in the bottom of the bag, there was a few brown leaves that we didn't realise.
It was very fine.
Very, very fine brown leaves, and that was enough to give me a high.
And I didn't want to waste it, so I actually put in a couple of handfuls of this nice fine stuff, because I didn't want to waste anything, but there was obviously enough dry, very fine leaf in the bottom. But yeah, poor Sharon, it knocked her out for about 14 hours. Wow. Best sleep ever.
But that's when your body heals. I mean, that's the worst side effect is sleep, so that's not too bad.
Well, I was going to ask about side effects, and
just the only other obvious one is a very, very dry mouth, extremely dry mouth, to a point where you feel you're going to almost choke on your tongue. Right, it made your mouth very, very dry.
And, like you're saying, you said it feel like you got a camel's tongue.
and do you get the red eyes that are synonymous with?
I've never noticed the red eyes.
No.
Okay,
no,
so
and even I've been on cannabis every day since February in some form, whether it's under my tongue or suppository backdoor method, or juicing. I've had something, and I had a reason to go to hospital for a virus for 6 days, so I didn't have it obviously for those 6 days. There was no withdrawal or any problem or wanting it or anything like that. So it was no
headaches or shakes or whatever you're supposed to get.
No withdrawal from it.
Okay, I'm going to get a little bit personal here, Sharon.
Sure.
When you're talking
up close and personal.
Okay. when we're talking about inserting the cannabis oil anally.
Yes.
And you're using a syringe, aren't you? Because you said a suppository didn't work very well. It was a bit messy. So you're actually using a syringe. Is there a purpose-built syringe for that job? Because syringes are usually not meant for inserting anally, are they? Or are they?
Okay, I never thought of that, but it was just a very small 1 ml syringe with the suppositories. We tried beeswax and we tried capsules. And it's such a small amount, and then you mix it with the oil, it was very difficult to put in before it melted, and then we're losing our very expensive medication, and so we had to come up with another way. Okay. And this way is just spot on and perfect. There's no mess and there's no wastage.
And it's not painful.
Not at all.
Okay.
No, not painful.
Okay. And I thought, without getting gross, we are talking personal, when you look at the length of your finger, whichever one you would use to insert a suppository bullet, I suppose, the little 1 ml syringes we use are almost the same size. So we feel that some say that, you've only got that little pocket where it's the best absorption, like the membranes that are in your anus to absorb it into your system, that some have said, you can push it in too far, or if it's not far enough, it'll leak out. But we've done our math, so to speak, and if the 1 ml syringe is very close to the same length as your finger, and so when it's inserted, it's in the right spot, and Sharon lies on the side, you know. And
I put a little bit of the coconut oil around the area and on the syringe for a bit of lubricant as well.
Okay. And it's no mess, there's no drama, and the syringes we could buy a box of 100 for around $20, and they're like hospital grade syringes. So, and it's just the barrel. There's no needle or anything attached.
And we throw them away every time just because of infection.
Well, as we speak, I've just written a provisional patent on a new shape of syringe for this purpose. So because I know
shape. I wonder what that shape would be.
Yes, well, more like a finger than a syringe. I can tell you that, Neville.
You can have it in the hand, so you just push the thumb down and it puts it in.
Hey, now this is my idea, Neville. Okay, so I don't want you to infringe upon my my patent.
I've got enough going on up here without worrying about your syringe.
Okay, now the dose.
Contains so much.
Let's get off that awkward subject of the syringe and the shape, and let's go on to the dosage. Let's talk about the dosage and how much you're taking a day, because, and I want to mention this, I want to put Dennis Hill's name in here, because Dennis Hill was the first person that I heard of that I felt confident listening to his testimonial that he was telling the truth and everything. And he was a biochemist who worked for MD Anderson Cancer Research Clinic, was diagnosed with stage 4 prostate cancer, cured himself with cannabis oil, and actually explained how the cannabis oil killed the cancer cells, or helped kill the cancer cells. And he was talking about the dosage, the size of a grain of rice once a day before he went to bed. And the side effect was he had a great sleep, woke up, and eventually there was no more cancer. So now, you mentioned the dosage that you were taking was quite large, and I know you have a different form of cancer, and you mentioned it was far more aggressive than the prostate cancer that Dennis Hill had. Can you tell me about the dosage and the THC potency and everything?
Well, the main site that helped us is COSS on Facebook, Cannabis Oil Success Stories. And we didn't have anyone here to help us. It was just Neville and I and Precious to determine the medication and how much. But on that site, they said for aggressive cancers, you really do have to get up to 1 mil a day. And I couldn't get close to that. Neville made our first 2 batches of oil, just from local weed buds. And we followed a YouTube to make oil, and I used a toothpick. A tiniest little bit under my tongue, and every day I had that and increased it. But I guess I got up to about 3 sizes of a grain of rice under my tongue.
Yep.
And I was just sleeping all the time, and I didn't really enjoy my life because I was too tired and too spaced out all the time, and I was concerned I couldn't get up to the 1 mil. And we too heard that you only needed a small bit under your tongue as well. So we didn't know, but all I knew is that we had the money through my super to get more oil, and so we really did have to try and get up to the 1 mil. And because I couldn't orally, we had to come up with another way, and that's when we tried the suppositories, and then we went on to the syringe after that.
Yeah, so I don't know with Dennis how he did it with just 1 rice grain every time. Like in our research that we did, it was for the more aggressive cancers, you need to get up to 1 gram a day, but we equate that to like 1 mil so that we know. But yeah, that was the goal that we believed was set for an aggressive, and they do like a 1 gram a day, and you try and get to it as quick as you can and maintain that. And they normally say that 60 days you can pretty well eradicate or kill off the cancer cells, but sometimes it takes longer. Or others we've read, this is again, we're not experts, that you need to even try and take more, you know, get up to 2, 3. We've heard of people taking more than 3 grams a day, 4 grams a day, even orally, which blows our mind. That must be whether the THC is not as high, we don't really know.
Could be diluted.
It could have been diluted. But even at that point, we had others then come